So thank you for your conference, to be a part of it, and we think that it is a good chi here. And this good chi in the conference, so international, it is a tool for us, not only for the patients. Such a conference is a good tool for us for hope, that we are successful, that we have enough humor. Like here, it is a presentation, Okay, thank you. Some years ago, I was invited by Rita, to give some data about pregnancy and acupuncture. And I will do it again a little bit further. And then Natasha, as a family midwife, she will tell what it is, a family midwife, because we do in our clinic the first part during pregnancy, and she does with other midwives, family midwives in Hamburg, when the baby is born. Okay. So I'm a gynecologist obstetrician, and for 18 years I do NADA. Okay, fine. And NADA in general is spreading in Germany. We are 16 trainers. It is successful in psychiatry, in day clinics, in hospitals, in stress reduction programs in firemen or policemen, and in geriatric, in children's trauma therapy, and so on. That's not my presentation now. Today I give you an impression what we in our clinic do with pregnant addicts. And these patients are one stress of our clinic. Our clinic, we are 3 doctors, 2 women doctors and me, 5 nurses, a midwife, and all are trained in the NADA protocol. But the most treatments of the NADA protocol are given by the nurses, not by the doctors. Okay. I will give you also some data, not a real scientific trial. It is difficult to do it in the practice, but some data. So I am a school medicine. I like this school medicine, but I like NADA too, and so I'm standing on 2 legs since 18 years. So we also train midwives in Hamburg, and especially family midwives. So that was a part of Natasha. And so I'm a little bit nervous today because the one thing is my English is not so good, so that my teacher in school said, okay, could you repeat it that even Raben can follow? Okay. Okay, excuse me. And the other thing is, in this night, at midnight, we get a grandson again. It is born. Both are hope. And Paul, my son, is uncle again. Okay, so my summary at first. NADA is effective. It is very effective in pregnancy, and it is safe to the patients. It is always safe to the women, and it is always safe to the fetus and the newborns. With the NADA protocol, you can't make any kind of special or dangerous side effects. That is in general, and if there is anybody who sees a different thing, I don't know what it is, but I've never heard about it. And there were 10,000 of treatments. All 5 points are safe. So that's what I say at first. It never harms a baby. And NADA, it's a word from Michael, is a midwife for the soul. Okay. It all starts, the tools of hope starts with this young man in Lincoln. The beads are also tools of hope for the mothers. They can also do it after they learned it. For the babies, for the kids, magnetic beads, you know it all. Alcohol and pregnancy is what we cannot see always. We mention more the drug addicted. But here, if you give the tools and the needles, you are treating 2 generations. This is a photo from Namibia when we taught some nurses from the WHO. The children's risk. You have all the things you can you have not to learn it all now. The risk of drug using or substance abusing, perinatal complications, sudden section is not good for the child. Premature labor may lead to brain damage or other damages or death. Brain damage, it is really difficult for a scientific examination to see it, but methadone and all these kinds of opiates and opioids will make, after 2 years of a child, they will not have the same good language as without. It damages the language, what they learn and what they speak, maybe a little bit their intelligence. Teratogenic effects this is more seldom. In later times we thought that cocaine will make some really mistakes of the body. It don't seem so, but the most effects are here. NAS is neonatal abstinence syndrome. The babies suffer 2 or 3 days after the birth. They start to suffer, and they suffer more than 6 weeks. Sudden infant death syndrome is more in taking methadone, but maybe also because they all smoke. ADHS, attention deficit hyperactivity syndrome, is more in children when the pregnants use methadone or any other kinds of the substances, benzodiazepines or what they all. Mother's risk, miscarriage, of course. Normal miscarriage rate is 25% in healthy women. Here you have miscarriages in 35%. Premature labor is also a risk for the mother. Amnion infection syndrome, more infections in the mother. Sudden sexual caesarea is a complication for the mother because the situation is in the next 5 minutes, baby must be out. A rupture of placenta is a dangerous situation, and this leads to excessive blood loss, and mothers will have, after the time, if the baby is 1 month or 3 months, and when the first time to be happy is over, a difficult baby, restless. So tools for hope is good for hospitals, inpatient and outpatient facilities, midwives. What is necessary, we think, a trustworthy, friendly, professional team, a structured counseling and controlling, another protocol. And always think, to be anxious, it is not the worst feeling. To be ashamed is the worst feeling. To be ashamed about you, about what you do. What can you do for a better outcome? Thank you, Nancy. I learned a lot in '95 and later on. And you too. Team accepts every pregnant immediately. So they are invited and not only a little bit treated. Another protocol is of fantastic effects. Also, it invites a complicated person, a pregnant, complicated person what is without any trust, to look what it is in the group at between 12 and 1 o'clock every day. Counseling and examination, urine testing, of course, so it must be enough severe. Midwives, They are both a combination from social worker and midwifing. They are near to the material. Normally, I'm gynecologist. It seems so that I'm near to the material or to the human, but it is not really. They are more connected. Perinatal units in hospital who know how to do with a baby or with a newborn what suffers NAS. And rehabilitation, therapy, of course, that's what the aim is, to change a little bit their life, and like Rita told, that needs that you have enough patience and time. Okay, tools for hope. Okay, das ist, Moment, das war falsch. So, now some data. I'm a medical doctor. I found, is NADA protocol in general effective in detoxification programs? You can say after this fantastic work of Schwartz from 1999, The Value of Acupuncture, I found it is one of the best publications about that. Journal of Substance Abuse, it is effective, statistically significant, if you do it in that way, not only needles. The next thing, a psychiatrist cannot treat depressive disorders without thinking about acupuncture. He must declare why he will not do acupuncture, because from 36 scientific trials, and they were very good trials, RCT, the effectiveness and safety of acupuncture therapy in depressive disorders, systematic review, it is done in 2010 from Zhang and different from Hong Kong. It is statistically high significant that the effects, the clinical effects of acupuncture in general, it is not only NADA protocol, is a little bit more effective clinically than medication. And of course, it never harms, only bleeding a little bit hurts. Okay, next thing, once more, acupuncture in pregnancy in general is safe. That's not my subject here, but also body acupuncture is always safe. There are no forbidden points. There is a new publication in one of the biggest journals from acupuncture in the world. It is a German journal of acupuncture, and the publisher is here, Tom Otz, with from 5,885 patients in Mannheim. They show that they never harm a pregnancy, never harm with their method a pregnancy, and also not a fetus. And also they give in the traditional education also so-called forbidden points. If anybody treats pregnant women, he must read more than the old yellow emperor. He has to do also with the new ones what they say. Then major depression in pregnancy. If anybody is very interested, I brought some publications here with me. High significant that acupuncture is clinically as effective as medication, but pregnants like more to be in acupuncture treatment than in medication. This is this publication, and this obstetrics gynecology is the best, one of the best journals from our subject in gynecology obstetrics, and it was a randomized controlled study. It's too long. They compared it with massage. Here, look around. Remission, it means all symptoms gone. It is no depression anymore. Both were effective. Acupuncture, in general, it is not special NADA protocol, was more effective than massage. And response, it means it is better than before. 63 patients in acupuncture, per person in acupuncture, 44 in massage, in treatment. Okay, this is statistically significant. So what is to do? Midwives, nurses, doctors, social workers, obstetrics and prenatal tests are combined with acupuncture, psychosocial care, rehabilitation. NADA can also accept medication. The most patients we see pregnant, they come on methadone. So 15 years ago, they come on heroin, on all things. Now they are all black or white medicated with methadone, and they want to reduce a little bit. We say, okay, be careful, we can do it. If you come to acupuncture, you can do it. And we are always on your side. So, Nancy, Michael, Carlos, not here, thank you for teaching and for encouraging one. Neonatal abstinence syndrome. Central nervous system and autonomic system and digestion system are damaged in this situation. But where they are alive and there is hope. And they hope to get tools. The normal therapy is medication. It's the beginning of the life. Morphine, opioids, barbiturates. Nobody has a good feeling with this. But nobody has a good feeling to let them suffer. Results. So 18 years, we start with the NADA protocol. 12 years ago, we looked on a row of 102 pregnants in a row. We invited them to come to acupuncture. They were offered severe, come, or maybe you need another doctor, a better doctor who will not take you anything about acupuncture. And look, come to the group, you see what it is. And in the groups are not only addicted pregnants. There are also maybe students who have tomorrow an examination or pregnant with other suffering for other things. This is 102 patients, all were on methadone at the beginning. We make 2 groups. We offered them all acupuncture. There were one group, they came once and then not again. Okay, that is without acupuncture. The other group, they come once and then they continue to 29 times during the pregnancy. And you see, look only at the yellow points. In the first group, only 19% of the newborns were not suffering NAS. Okay. And on the other side, 66. Here are the smokers, good effect. Next, newborns, I have my 2 ankles. The beads and body acupuncture, we do it now. Also, small body acupuncture, stick in, stick out. Okay. That's the style of treatments, tools for hope, nearness, relationship, team remains hopeful, keeps in humor. Okay, that's the last one. It's not healing the addiction, it is an intelligent tool, safe, effective, okay. And this is the summary. Don't read it. Okay, thank you.